ideally our tongue is pushing up on the roof of our mouth, which helps stimulate our vagus nerve. So our vagus nerve is responsible for a lot of things: rest, digest, heart rate regulation, getting us out of fight or flight. So relaxing our body, and it can help calm us. So if we're in a state of stress, our body finds a way to stimulate that vagus nerve. And usually it's our tongue pressing up on our palate. Coming from a background of dental hygiene, we didn't look at the tongue. We looked under the tongue for oral cancer. We looked around the tongue at the teeth, and we should be the people who are looking at the tongue. Dentists don't look at the tongue. ENTs don't look at the tongue. Nobody looks at the tongue until myofunctional therapists have really started to hone in on the tongue. So it's kind of been an ignored muscle.
Hello, welcome to Emotional Badass, where Moxie meets Mindful. I'm your host, Nikki Eisenhauer, life coach and psychotherapist. And on today's show, I'm interviewing Hayley Rutford, where we discuss myofunctional therapy. She's my myofunctional therapist, and how it can help with chronic pain, better sleep, and developing better breathing habits. Hayley Rutford is a registered dental hygienist with a bachelor's in dental hygiene and a minor in public health. She trained in myofunctional therapy and is a certified lactation counselor. Hayley helps her clients reestablish proper function of their oral and facial muscles. Longtime listeners, you know I've had some jaw surgeries in my past, so we're going to get into that in this episode. I'd like to thank Hayley for being on the show today, for being willing to share herself and share what's going on with my health with y'all so that we can all learn and grow and just be the healthiest version of ourselves that we can be. Hello, Hayley. Thank you for being on the show with me.
Thanks for having me.
I am very excited to have you because I think the work that you're doing is like the missing link for a lot of people that are in pain. If we have new listeners of the show out there, you might not know that part of my story is that 20 years ago, I had a massive jaw surgery to correct TMJ. I have had complications ever since. I have seen more practitioners than almost anyone on the planet in terms of chiropractic, acupuncture, so many practitioners, and have never really been able to get to the root of my pain. I help it a little bit. I mask it. I keep working with it. This pain even was a big consideration in me deciding to have children or not. So the last time I went to the dentist, I'm 44 years old. It's not like the first time I've gone to the dentist. He noticed that I had a tongue thrust. I've known that for all of my life. If I smile for a picture, my tongue comes forward. He referred me to you. Mm-hmm. And I have been working with you for a few months on tongue exercises. Mm-hmm. I have been absolutely shocked and flabbergasted at the difference in my pain levels since working with you. So that's my journey in getting all the way to you. Can you tell us a little bit about how you have journeyed all the way to this work?
Yeah, absolutely. And I'm so happy the progress that we're making. I just want to say that when you came to me, you barely had any control of your tongue, and just to see in the amount of time that we spent together, like how much progress you've made. So it just makes me really happy and excited. And to know that I'm having an impact on you and your pain level and function. So I'm just really happy to hear that. But I got into it. My background is in dental hygiene. I'm a registered dental hygienist, so I have a strong understanding of the oral-facial complex to begin with. And then 3 years ago, I had a son, and during breastfeeding, we really, really struggled. And we sought the advice of a bunch of different people, and we were sort of pushed into formula, bottle feeding. And it wasn't until I reached out to a pediatric dentist, Dr. Jesse Witkoff, that they diagnosed him with a tongue tie. And then it was kind of throughout that whole process that I got introduced to this world of airway dentistry. Dr. Witkoff, kind of persuaded me to go on and get advanced training in myofunctional therapy. So based on my background in dental hygiene, I was able to go on and get that credentialing. And I've kind of built a little bit more of a practice starting from infancy. So I'm also a certified lactation counselor. So I can help pinpoint dysfunction as early as possible. So I see all ages. It was a couple of years ago throughout my personal journey. And then after that, I noticed dysfunction in my husband. He was snoring. He had borderline sleep apnea, never diagnosed with it, but I noticed that he had a tongue tie. And it is genetic. So it made sense that that's who our son got it from. So he went through the process of myofunctional therapy, and I got to see the impact on him and mentored a myofunctional therapist throughout that process. So it's had a profound impact on my family. And now I love sharing it with the world. And I honestly hadn't really heard a ton about it when I was a dental hygienist. So it's been really enlightening and eye-opening to be in this different side of dentistry that I've found myself in now.
I love how your work and my work come together to intersect. So a lot of the listeners of the show, like me, come from very dysfunctional families and have a lot of childhood trauma. One of the things I don't think I've ever talked about on the show is that I was a very, very hard thumb sucker. And of course, we don't want our kids sucking thumbs. And I was born in 1980. So I'm sucking my thumb through 1980, 1985. And I give a lot of hope on my show. But one of the hard realities is that when we come from really unsafe backgrounds, there is such a long arm of effects. And this is such a long arm effect for me. I was sucking my thumb very, very hard. Of course, that makes perfect sense to me now. My mother is very much an ice queen. They had a domestic violence type relationship for those early years of my life. I was born. They gave me last rites. They thought I was going to die. I had severe asthma. I had night terrors. For me, sucking my thumb was really the most primal way that I could try to soothe myself. Now, we don't just want a kid to not suck their thumb because, hey, get your thumb out of your mouth. We don't want you to live and be 16 with your thumb in your mouth. I changed the shape of my upper palate. Can you tell my listeners what you have taught me about how our mouth, our facial structure is really supposed to form, and what happens if our thumb is in our mouth too much? Because I know so many people listening sucked their thumb way longer than what is typical. So please give us your wisdom here. This was such a big game changer for me to hear from you.
Yeah, absolutely. So first, I kind of want to talk about why you sucked your thumb. So ideally, our tongue is pushing up on the roof of our mouth, which helps stimulate our vagus nerve. So our vagus nerve is responsible for a lot of things: rest, digest, heart rate regulation, getting us out of fight or flight. So relaxing our body, and it can help calm us. So if we're in a state of stress, our body finds a way to stimulate that vagus nerve. And usually it's our tongue pressing up on our palate. If we need extra stimulation, we suck on a pacifier, we suck on a bottle, we suck on a sippy cup, or we suck on our thumb. So we're stimulating that vagus nerve. Sometimes we can't stimulate the vagus nerve. So in your situation, you have restriction under your tongue that's pulling your tongue down. In addition to having that stressful environment, you needed a lot of extra stimulation of the vagus nerve. So you found a way to get it by sucking your thumb. So you were able to get those relaxation effects. But instead of having your tongue up there, you had your thumb. Your thumb is extremely narrow compared to your tongue. So when you have your thumb up there, you're not putting pressure on your teeth like ideally your tongue would. So those teeth naturally want to shift inwards to the midline. And when our tongue's not putting pressure on them and you have a small thumb in there, they come in very narrow, creating a very narrow upper arch. And our upper palate is the floor of the nose. So when our upper palate is coming in extremely narrow, our nasal cavity also narrows. So this makes nasal breathing harder. This creates airway issues. This starts to shift the shape of our jaw. So when our upper jaw narrows, our lower jaw also starts to narrow too. So this is why we see a lot of people maybe needing expansion. So maybe a lot of your clients or people that you work with later on in life need to have orthodontic treatment because they had these, we call them oral toxic habits. So thumb sucking is one of them. Prolonged pacifier use is one of them. And all of those can significantly shift our jaw structure. So the earlier we can help pinpoint these dysfunctions and teach people, instead of putting your thumb up there, let's promote to get the tongue up there. So that's one of the tools that I help people. And one of the goals of myofunctional therapy is correct tongue posture. So with you, you started to get a tongue thrust, which kind of comes with that habit as well. So when you have the tongue in the improper posture, it affects swallowing. So instead of your tongue going up, it starts to go out. And that also shifts our teeth as well, which continues to narrow and affect our nasal passage as well.
So if my thumb was up there as I tried to soothe myself, my sort of fat, flat tongue couldn't go up to the roof of my mouth and make the top of my mouth as wide as it was really supposed to be. And what you're saying is I have a double whammy. Behaviorally, the behavior of sucking my thumb impeded how my mouth developed, but I also have a strong tongue tie. Can you share what's going on with our American culture around this tongue tie thing versus what's going on in other places?
Yeah. So back way before, maybe in about the 30s, we used to be a lot better at looking for tongue ties. Midwives would actually grow out their pinky nail and look for it and go under the tongue and just release it very, very early on. But then in the 70s, we really started to push formula and bottle feeding. So we got out of the habit of looking for tongue ties. We completely stopped looking in the hospital. We didn't really notice as much because we weren't seeing the issues start to come up during breastfeeding. You can kind of get around it with bottle feeding. You don't need as much muscle strength to release milk from a bottle. So we really started to get out of the habit. So now a lot of people are like, why does everyone now have a tongue tie? Well, we're getting better at looking for it again. We're really starting to recognize that it can affect a lot of things. It can affect breastfeeding. It can affect speech. It can affect sleep, jaw development. In other countries, so Australia is one of the best at diagnosing, treating, and pinpointing early on. They look for it in the hospital. They look for it during birth, and then they release it right away. So here, unless you catch it in the early feeding journey, it usually gets missed. Unfortunately, we don't really talk about it in dental hygiene school. We didn't talk about it in the aspect of how much it could affect you. We only talked about severe tongue ties. So if the little string goes all the way to the tip of the tongue, yours does not do that. Most people's do not. That one people catch because that person is not really able to gain weight. They can't talk, but we're missing those ones that are less severe because we don't talk about all the other things that come with them. So one of your biggest things is pain and compensating in other areas. So when you swallow, when you speak, you're compensating by holding tension in these lower muscles instead of being relaxed. So you carry a lot of pain and tension in these areas. It can create a lot of grinding and clenching in individuals. So yeah, we're getting better. A lot of dental hygienists are now starting to get better trained on it. Myofunctional therapists are trained on it. Anyone who's in airway dentistry understands how to properly diagnose a tongue tie because we're not only looking at where is it in the mouth, but we look at function. Can someone move their tongue up, down, right, left? Can they move it out really far? Do they have any compensation? So there's a lot more that goes into it that we're starting to get better at diagnosing and treating.
Part of what came up for me when I started working with you was a big grief because I've put so much effort into trying to figure this out. And I've had so many different people over 20 years not notice this. The week after you gave me my first exercises, I have some neighbors that are 6 years old and 3 years old. and they came over to my house and we were hanging out. And very organically, I just saw the little 3-year-old moving her tongue in her mouth. And it really, really struck me because I left you going, I wonder if I really have a tongue tie. I mean, I certainly have this little bit, but do I really need a surgery on this tongue tie? I don't know. And I saw her tongue flop out of her mouth and it was so wide and so flat and came out so much further than mine has ever been able to come out of my mouth. It felt like a slap across the face. I was like, oh, that is the difference between my mouth and her mouth. And I just knew in every fiber of my being, okay, this is the thing. Now, I have a lot of awareness of my body from all of my years doing yoga, being a yoga teacher. When you talk about the vagus nerve, I even have a visual because I've gone into cadaver lab to learn more about the body as a yoga teacher. So I've actually seen the vagus nerve. And I think when people think about a nerve in the body, first off, a nerve is a very thick, very ropey structure. I have some permanent numbing. Maybe it won't be permanent as I do all these exercises and bring some sort of life force back to it. But they severed one of my nerves, which is it's almost like cutting an extension cord or something. Like a nerve is a very, very tough piece. The vagus nerve is very thick and very large. I was shocked to see it. And it was about the size of my pinky finger. And it runs all the way through our bodies, through our core, through our gut. So through the 90s, we went through hyper specialization in all healthcare, and we're still, I'm going to use the word suffering. We're still suffering from that because on paper, it makes so much logical sense. Oh my gosh, if I have something wrong with me, I want to work with the best specialist who only focuses on this. I mean, that's a really hard logic to get beyond. But in the 20, 25 years, maybe 30 years since we've done that, what's happening is these hyper specialized people miss the bigger picture of how the human body works together because of this hyper specialization. It's part of my grief that because of this hyper specialization, so many very well-intentioned, highly educated practitioners have missed this for me. When you gave me those first exercises, I can't stress enough how much I could tell that those muscles had not been worked maybe all of my life. I think we all have in our consciousness this visual, maybe from seeing clips online, movies, of someone who has been in a coma or someone who maybe had a severe accident and then has to relearn how to walk or has a brain injury and needs to learn how to walk. And we can see how excruciating that is, the concentration, the sweatiness of the entire body trying to will that part of their body to move, to get that brain signal to tell that part of the body, hey, do your thing here, do it, stretch, do it. I would get sweaty doing those first tongue exercises. I had to concentrate in a way that in a logical way makes no sense to me. But in understanding my body, it's like my tongue has been in a coma maybe all of my life. I have been working with you for months and months. And as you give me new exercises, it is a shock to my system how much my face has been unable to do these and what my face and my tongue have been doing in the absence of knowing what proper function really is. I've had chiropractors, very skilled ones, give me exercises for the back of my neck. I carry most of my pain through my neck, through my trap, through my jaw, which triggers headaches and temporalis muscle spasms and issues. It gives me severe headaches into migraines. I had never, ever felt the sort of front of my neck, the back of the throat. Will you tell the listeners what the tongue is? These exercises that you're giving me, it's mind blowing. I know I can do a bunch of exercises with my arms and with my legs. The amount of exercises you have given me for my tongue have had me like almost like laughing and like, because it's almost like silly that we have ignored this part of the body. People who work out all the time, all the yoga I've done, to never ever think about this muscle. Talk about this muscle.
Yeah. Well, like you said, everything is so specialized, and coming from a background of dental hygiene, we didn't look at the tongue. We looked under the tongue for oral cancer. We looked around the tongue at the teeth, and we should be the people who are looking at the tongue. Dentists don't look at the tongue. ENTs don't look at the tongue. Nobody looks at the tongue until myofunctional therapists have really started to hone in on the tongue. So it's kind of been an ignored muscle. A lot of people like to say it's like the strongest muscle in the body. It's actually comprised of 8 different muscles. So that's why we are doing so many different exercises, because we're really working all the different aspects of the tongue. We have to work the sides, the front, the middle, the underneath. So really trying to build tone in a muscle that's never had the tone is what we've been doing. It's so important to get it in the proper resting position, so up in the roof of that mouth, for a lot of different reasons, but that can have an impact on our digestive system, on our pain. Having it up in that palate opens up our airway, so it can help with sleep apnea. So individuals who get a diagnosis of sleep apnea, we often put a lot of Band-Aids on people. We tell them, get a CPAP machine. Well, we aren't looking at the root of the cause of why they have this diagnosis of sleep apnea. A lot of people attribute it to overweight men with large necks, which is not true. There are kids who have sleep apnea. It's all related to, are we breathing properly? What's our anatomy? How's our tongue functioning? How are our throat muscles? So yeah, it's definitely like a forgotten part of the body that I think a lot of people only really start to hone in on it if we have issues with speech. If we can't talk, if we have a lisp, we get sent to a speech therapist. Sometimes speech therapists are trained in myofunctional therapy. That's the other background. So it's dental hygienists and speech therapists who go on to get this training. So some of them are, not all. A lot of them don't understand that tongue ties have a profound impact on speech. Some of their exercises are the same as ours, and some of them aren't. They aren't necessarily looking at breathing as much as I do. So yeah, I really think that we just like haven't talked about the tongue nearly as much as we should have. So in myofunctional therapy, one of the 4 goals is correct tongue posture. I can go into all the goals if you want, but the second goal is nasal breathing. The third one is swallowing correctly. So with you have that tongue thrust, which is the most common dysfunction we see in swallowing. So that tongue kind of jutting out of the mouth, and then a lip seal. So if our lips are parted, we want them completely sealed. So we also work on some strengthening our lip muscles, which we didn't have to do a ton of that with you. We are doing a lot more oropharyngeal, so throat and tongue exercises with you, because that's really where your dysfunction was. And that's where you were lacking that tone. I mean, but you have made so much progress. We took a before and after picture at the 3-month mark. And one of our exercises that we sort of check in to see your strength is suctioning our tongue to the roof of the mouth. So when I had you try that at first, you couldn't do it. You could put the tip of the tongue maybe up into the roof of your mouth, and that was it. And then after 3 months, you are able to do that. So that's how we want the tongue during rest, during swallowing, during sleep. And you are starting to have that be a habit, which is amazing. And it's really cool to see that we can work a muscle that no one would ever think of working out. And it is really funny. I mean, we're making funny faces at each other all day. And then that's what you have to do at home too. So it's a really strange thing. And I think a lot of people probably haven't heard of it, but once you have heard of it, I feel like it's pretty life-changing. And then I think a lot of people start to really understand like how much it's connecting all these missing pieces in their life. Like, does someone have TMJ pain or chronic headaches or sleep issues like sleep disordered breathing or sleep apnea? Do they have food allergies? A lot of this is going back to the vagus nerve not getting stimulated. We're not stimulating our digestion properly. Do we have speech issues because we're not working our tongue properly? There's so many different issues that can come up if we're not working our tongue the way we should.
When I think about like an arm muscle or a leg muscle, I can tell where that muscle begins and ends. You know, where does the tongue, like we can see where it begins, we can stick it out and see the tip of it. Where does it end?
Yeah. So that lingual frenum that you talked about, that yours is really tight, goes all the way down, all the way through our body, all the way to the toe. So when we have a really tight underneath of our tongue, we will hold tension in every aspect of our body. It's actually really, really crazy. I've gone on into feel a tongue tie release from a couple of the different providers that I refer to. And people will have this like wave of relief in their body of this tension that they've had, and they can't get relief. I mean, like you said, maybe it's temporary. Sometimes, it lasts a few days after they go to the chiropractor. But and myofunctional therapy is a multidisciplinary approach. Like you already had the providers that you were seeing in place, but if you hadn't been going to a chiropractor or an acupuncturist, I would have referred those individuals to you as well, because we also want to break up tension manually. So we're creating proper function by working our tongue muscles and strengthening tone, but we also need someone to manually get in and break up tension. So with massage, with acupuncture, all of that really helps as well.
I think that's an important piece for trauma survivors to take in. First off, did y'all hear her say the tongue goes all the way to the toes? Like really sit with that idea for a moment, because I think for most people, particularly Americans, that is such a foreign idea. I mean, that sounds to us like, oh, this little green alien like just dropped down and is going to serve me lunch. The tongue connects all the way down to our toes. We have such a problem in thinking about ourselves as like mind or body or our parts being these separate things. Like, oh, if I break my arm, I need to tend to just my arm. But everything else that connects is affected. Every single thing. For those of you who are listening to us and not watching us on video, Hayley has been referencing the front of the neck and the front of this chest area. Now, I don't have snoring issues, but what I do have is when I swallow. Now, I've had this my whole life, but I didn't know how to see it. Right? Just like y'all come and tune in, and you might have things that you've dealt with your whole life emotionally. And until I highlight it or talk about it, it's like, oh, I didn't know what that was. I just know that I had it. Whenever I swallow, I have a hard time swallowing. I feel a tension. It's like the top of my chest lifts up because there isn't enough space there from that tongue tie. Now that you've shown me this and pointed this out, I can tell every time. Now, I am a minimalist, in part because of everything I've gone through health-wise. Part of this jaw surgery stuff was they had me take all my 4 wisdom teeth out. Now the wisdom is we don't do that. And so I'm very slow. Like this is a new surgery to do this tongue tie thing on an adult. So I have the hunch that I'll probably do it eventually, but especially because I speak for a living, I may just do the exercises for a very long time. And it's part of why I chose to do this with you. Mm-hmm. Because you heard me say, you were like, yeah, I think you're a candidate for this surgery. And I said, I'm probably going to move very slowly and I might not do it. And you absolutely supported me in that. You didn't push it against it. You totally understood. You also have been willing to work with and educate and learn from them, the team that I have cultivated. So I hope to have her on the show one day too, but you also met with my acupuncturist and I just love her. Her name is Nandy. She's in Netherlands, Colorado, and acupuncturist not from our Western medicine, from Eastern medicine. They look at the tongue. Mm-hmm. She had been looking at my tongue before I met you, telling me my tongue was really stagnant. Mm-hmm. To our Western ears, we don't really know what that means. She's been able to see my tongue looking different. And the reason that it's important, I hope to have her on to share her expertise instead of me. What she said to me was, the tongue is the only muscle in our entire bodies that we can see without skin on it. Mm-hmm. And I thought, that's exactly true. Why haven't I ever had that thought before? Why haven't I ever known? She said that the tongue can show us all kinds of information, how plump it is, how rich it is, how blood flow is happening. We can get a lot of information about all of the muscles of our body just by looking at that tongue. So I am fascinated at how all of these things fit together. What I hope people take away from this part of the conversation is that there really are healthcare practitioners out there that will meet you where you are, that don't have an ego problem, that don't have to shove their way of doing it down your throat. With healthier people that have a maturity, they're not going to pressure you. They're not going to push you. They're going to hear your concerns and go, yeah, those are real concerns, not dismiss your concerns or make you feel crazy or stupid or overly sensitive for having the concerns. And I just want to use this moment to thank you for that, because that is, unfortunately, tragically, I would even go so far as to say sometimes criminally a problem in our healthcare.
Yeah, well, thank you. I appreciate that. And it's something that I really pride myself in. I think that we push medicine, steroids, surgeries so much on people. And everyone has a right to question, why are we being told to get all these things? And is it necessary, or can we figure out another way? And I do think that the tongue tie procedure would be really, really helpful for you. But I also think that if you're willing to do these exercises every day for the rest of time, you could probably maintain what you're doing that way too. So there is a middle ground. And I think that's part of why I love what I do, is because I'm not pushing surgeries on people. I'm not pushing interventions. Like, I'm really getting into why is this happening and how can we help it? So one of the biggest things I also work with are people who have braces or have had braces and things have shifted back. And it seems like almost everyone just gets told around their teens, you need braces. Just because it's common doesn't mean it's normal or that it should be happening. Our jaws should be broad. They shouldn't be crowding. We shouldn't have really narrow arches. This has changed because we're pulverizing and smashing our food into purees. We're introducing bottles. We're introducing pacifiers. There's a lot of different reasons. We've been studying jaws of our ancestors and now. But back then, we had really broad jaws. We didn't have all these issues. But if someone needs braces, I want to meet them in the middle. And I want to say, okay, that's great that you are working with an orthodontist. And I think that that's something that is going to be really helpful. But you're not changing function. You're putting another Band-Aid. You're getting another procedure. If you get braces and you don't pair it with myofunctional therapy, they're going to shift back. And that's the unfortunate part. So it's the same thing. If you go get a knee procedure, so you get an ACL procedure, but you don't get physical therapy, it might not heal as quickly or as effectively. So that's really where myofunctional therapy comes into play. So if you need braces, if you have a sleep disorder breathing, if you have TMJ pain, they can throw all these things at you. But it's only a quick fix and it might not last. So myofunctional therapy really changes function, and it can be life-lasting changes because we're creating proper habits. We're not having the compensation. So in that neck, shoulder region that you had, we're really starting to get rid of all that stuff. And sometimes we do have to intervene with surgeries like the tongue tie procedure. Sometimes we do have to recommend jaw procedures. Sometimes people do have to get their tonsils out. Ideally, we can shrink the tonsils if we create nasal breathing. But sometimes we do have to recommend those things. But I'm very cautious on referring out for those different things. And in my world, I'm a part of the Airway Circle network. There are practitioners in every part of the world that I have access to the directory. So I can refer to individuals in this same kind of network that I'm in. So I kind of trust those individuals that they're not going to intervene with really intense surgeries or stuff like that. Because we all have the same goal in mind, and that's airway. We're all concerned with not having small airways. We want to be able to breathe good. So that's really cool that there's a couple different networks, but that's the one that I belong to. So I have access to a bunch of different people. And you had a really great team already, which is really, really cool that I've gotten to meet your acupuncturist and hopefully meet your chiropractor soon. And you have a really great massage therapist on your team. So they're all so important, and it all of healthcare, it's never one individual. So same with you. I mean, you're in mental health, but you might need a couple different mental health people to help you meet your goals, because everyone's specialty is a little bit different. Everyone has a little bit of a different insight, and that's kind of how my world is too.
Part of what made me trust you is because you did something that's very important to me the first time I met you. You acknowledged. And I think acknowledgement is really, really big in terms of building safety, trust, understanding in relationships. I don't care if they're professional relationships, personal relationships. Acknowledgement is very, very important. And it shows in a maturity and an ability to see the bigger picture. One of the things you acknowledged to me is this is kind of a new thing. And whenever there's a new thing, I see it in therapy world all the time. And I'm not happy about it when I see it, because I think it waters down the effectiveness when we try to do things too quickly. I think medicine, healthcare, all of healthcare has really played into what I call the inner adolescent. I think we all have an inner adolescent. My inner adolescent doesn't want to do the hard work. It gives eye-rolling energy, like, oh God, what do I have to do? I don't want to do that. Wait, there's a surgery? Yeah, just give me the surgery. Our inner adolescent, I think, really loves the Band-Aid fixes. Mm-hmm. Somebody will save me. This thing will save me and I don't have to do the hard work. Mm-hmm. I think maturity is really leaning into, the best things are worth the effort. Mm-hmm. And that is true in almost every way we could possibly consider it. And in this regard, if you're resonating with what Hayley and I are talking about and going, oh my gosh, this might really be a missing link, I want to acknowledge that you get to let your inner adolescent have a little hissy fit. Like, I have had to allow my inner adolescent, my younger parts, to sit down and go, this is not fair, and have a real moment of pouting. Why do I have to work so hard on this? Why do I have to spend so much money trying to figure this out? I have seen the best specialist across the entire country. Why am I still trying to do this? This is unfair. It's wrong. Mm-hmm. And I think we do need to sit in that sometimes and give ourselves a moment. We just don't want to get stuck in that moment. So I want everybody listening to know I have had those moments of anger, of frustration. And what that really is it's grief. I've lost a lot of time to not being able to figure this out till now. And we can't just hop over that grief process, y'all. Yeah. I also hope y'all are hearing that healthy practitioners can have these conversations and can acknowledge what isn't so healthy in their field. Part of what you acknowledged for me is that there are practitioners out there that are kind of jumping on this bandwagon and offering these surgeries. Can you speak to that?
Yeah. So specifically speaking on the tongue tie, it's been in the media a lot. I've heard it on podcasts that it's getting overdiagnosed. Basically, when there's money in healthcare, sometimes people have ulterior motives, and it's really unfortunate. So there are specific practitioners, mostly dentists, that get their hands on a laser. They don't have the proper training. And unfortunately, they tell people they need tongue tie procedures, and maybe they do, but they don't recommend things like myofunctional therapy to support what they're doing. So with the practitioners that I refer to, they have gone on and gotten extensive training on the procedures that they're doing. And they only do tongue tie procedures on people who have gotten myofunctional therapy before and after, because the research is really validating that the success and the outcomes are going to be much better when you pair it with creating proper function and strengthening the tongue before and after. So when there are people out there doing it without that proper training, unfortunately, usually it grows back. Not always, but a lot of times the connective tissue under the tongue will reconnect. And then a lot of people think that, oh, I just spent a lot of money on something that didn't even work. So it's unfortunate and it does happen. So that's why, I would really recommend if anyone has any concerns working with a myofunctional therapist, because we are considered the quarterback of the team. So we kind of have those people in our corner who we know to go refer people to. And I mean, I get it. It's tough when people live in really remote areas because there aren't really great providers in every part, of the world. But the two people that I mostly refer to in Colorado here, people drive from surrounding states just to see these two individuals because they are trained properly. They are kind of experts in their field. They speak about what they do. So yeah, it's really unfortunate because there's a lack of education, there's money in it. And then, sometimes just like quick training. So these laser companies will host really quick trainings for mostly dentists at conferences and say, overnight, get this training on how to do a tongue tie procedure. And that is not what it is. It's much more involved in that. They should have much more extensive training. And that's, every part of healthcare. But that's completely understandable why you're grieving, because, if a lot of people either missed or kind of steered you in the wrong direction, you're trusting these people who you think are experts in their field. A lot of my patients, they do get to me and I'm sort of the last resort. Like they've gone to however many people and they've never often been told certain things about their oral habits until me. So sometimes I have to gain their trust because why am I the first and only person to tell them these things? It is a weird idea. And then they look back and say, well, why didn't the dentist tell me that as a kid? Why didn't the pediatrician tell me this? Why didn't, the dental hygienist notice this? No one in however many years. So in your case, like 40 something years, notice these changes and habits in your mouth. It's frustrating. It's completely frustrating. I see a lot of individuals be told to get not only their wisdom teeth taken out, but other permanent teeth, which closes our airway, making it smaller. And it still happens. I had a patient last week who was, she's 14 years old and she got all of her premolars removed a year ago by someone in my area. And it's really disheartening that people haven't gone on to get the proper training. I'm encouraged that we're going in the right direction. And that's all I have to have is like the encouragement. And, I hope that I can do my part to kind of educate people on what, the right direction is. But yeah, the grief is real. I think almost every single one of my patients had it. Like I personally don't have any of that, but being a breastfeeding mom and how I got into it, I was told by probably like 5 people that I couldn't breastfeed because it was my body and it was something that I was doing wrong, which is absolutely not what the case was. It was something structurally in my kiddo's mouth. So I got postpartum depression and I actually had to go on something, which is extremely common in moms of kiddos who have oral dysfunction. And so I think I hit like the lowest point in my life before I really got into this field. And now it's been like really eye-opening and uplifting to know, and really kind of be able to relate with my patients. Like I haven't personally been there, but I've felt the defeat and the sadness and the grief of why am I supposed to be trusting all these people who are telling me kind of poor advice, unfortunately.
What I wish people knew about healthcare is that it's easy to make the assumption that our schooling and our programs and our licenses do some kind of screening for insight, empathy, maturity, personal responsibility. And there's none of that, y'all. There's none of that. If you can pay for school and you can get the grades, you can come out. It doesn't matter if you're a sociopath. It doesn't matter if you're a psychopath. It doesn't matter if you're a narcissist. It doesn't matter if you're not that intelligent. If you can jump through the hoops, you can get through it. And to be in the position of being a caretaker of another person's health, it's bigger than what you can learn out of a book. It's bigger than what you can test on. You have to also have the moral capacity to hold space for that person. I doubt there was any direct training for you to realize that you're basically dealing with people's medical betrayal trauma, their grief,
Yeah.
their heartache, their distrust, because they've been told, oh, I'm a specialist. I'm the best specialist in the field you can see. Well, then why didn't you know these things? There's also a long arm effect of or a bedside manner. You know, if there was one thing that I could change like a magic spell, it would be to give every practitioner the language to say, I don't know why this is happening, but we're going to keep working at it until we figure it out together, instead of, hey, I don't really know, so I'm going to tell you that it's something you're doing wrong. That can send somebody into depression, like you're saying. There are long arm effects of that depression, to put medication into your body, to think that something is you, to take that precious time when you were a new mother. It is so morally wrong, but it's so normalized. You know, like so many of our dysfunctions, like obesity is normal in our country now. It's not healthy. Normal is not necessarily healthy. So I think we have a bedside manner that is so dismissive of people. And often more sensitive people have more connection to, hey, something's wrong either with my child or in my body or with what's happening or with your feedback or your vibe. And we just haven't had a lot of encouragement about what to do with ourselves in those moments. And I hope from this episode and everything I put out that people take away more empowerment to sort of stand on your own 2 feet, to be able to look a doctor, a medical professional, a counselor, anybody in the face and say, I hear you. I understand that that's your perspective, but something about this doesn't feel right to me. And I'm going to keep exploring before I just grab on to your perspective. I'm going to keep exploring other perspectives. Y'all, there is no one solid right perspective out there. That's very, very rare. You're going to find people and practitioners, friends, people you date who have different perspectives. We get to feel each other out in all capacities and decide, hey, is this a perspective that I want to allow in my life? Does this resonate with me? Does this seem right? And if the answer is yes, cool. And if the answer is no, you get to move away. You get to keep exploring until you find the thing that you think is right for you. And with healthy practitioners, they'll give you a chance to let trust develop.
Yeah, I completely agree. I think the biggest thing I've learned is advocating for my own health and advocating for my children's health and allowing my patients to advocate for their own bodies, their own health, their own goals. And I always, at the end of the day, want to know what their goal is and meet them where they are. Like by pushing my agenda and my goals on them, well, for one, I'll just lose a patient. They're not going to trust me. But it's tough. To learn how to speak up to someone who has that medical license. It's a really tough thing to do. I wasn't always really good at it. That's why it was such a struggle for me early on. And now I have another son, and early on, I told everyone, this is what's going on and this is what I'm doing. And I trust myself. And even then it was really hard. Like I'm an expert in my field and the pediatrician didn't agree with me. And I sort of backed down, and it took me a few months longer than I would have hoped to go get his tongue tie procedure done when I early on knew it right away. But it's a learning process that I'm sure you talk about with, your clients and people daily, that, we just keep having to practice. But yeah, advocating and sticking up for ourselves and our loved ones is really hard, but really beneficial.
Really hard and really beneficial. I have this theory that the universe sort of looks down on those of us who need to learn this lesson. Like, hey, it's your one precious life. You have every right to stand up and speak for yourself. And I could say that and everybody would nod and agree and go, uh-huh. And then the actual execution of that is where it gets hard. Lots of us were taught to be people pleasers. Lots of us were taught to just kind of be like sheep around an authority figure. And for authority figures that have ego or righteousness in their way of being, that becomes really, really hard. I think the universe really looks down sometimes and goes, oh, are you working on this? I'm going to give you exactly what you need to get you to the place where you will speak up for yourself. And it's certainly not going to be from some kind of comfort. It's going to be from you being so uncomfortable that you decide, I must speak up. There's no other option for me. Do you find, like I find, that each time life has sort of done that to me, the next time I have to speak up for myself, it is easier. That is what grows the confidence of, oh yeah, I do get to trust myself. This is my life. And I am going to trust my mind, my heart, and my gut. And I'm going to live from that place.
Yeah, absolutely. I guess like professionally speaking in my business, so I'm the only myofunctional therapist in my county and the surrounding counties in Colorado. There's a handful in the Front Range area, but almost daily, I have to have really hard conversations with dentists, pediatricians, ear, nose, and throat doctors. And a lot of times I get put down, belittled, questioned, and it's gotten easier. This is my second year as a myofunctional therapist. And early on, I almost would avoid those conversations. I would sort of, call the front desk, and I had some screening questions to kind of gauge where they were on, airway and goals that I have. And if they weren't answering them correctly, I wouldn't waste my time. I would just go on to the next office to introduce myself. And now I'm ready to have those hard conversations. They've gotten easier. I feel like my confidence has also, gone up because I've been in the field longer too. So naturally I do feel more confident, but I think just if someone isn't going to see eye to eye, like I can take that feedback and I can sit with it now and move on. Whereas before I would take it personally, and it has nothing to do with me. It's about them and their lack of education and understanding and continued education. And that's on them. It's not on me at all. So yeah, it's definitely easier the more you do it and the more that you put yourself in those vulnerable positions, I think.
Hayley, thank you so much for being willing to do this.
Yeah.
With me, and for this audience. I'm feeling my choked upness.
Oh,
not just for the information about the tongue, but for modeling for my listeners, the kind of practitioner you are. This is what everyone is looking for. People that will actually care and have like some skin in the game with you to figure things out. And it can't be said enough. Like the work that you do to get somebody out of pain is life-changing. It's life-changing. So I can't do what I do fully when I'm in pain. So you've helped me help so many people, like through the podcast and through my own clients. So thank you. I know it sounds corny, but I'm a big believer that we heal this very messy world one person at a time by doing the work ourselves. And you were just such an example of walking that path yourself, and look where it brought you to helping other people walk that path. And thank you for all you do.
Well, thank you. And I'm so grateful for you and bringing me on here and for, trusting me and working with me. And I'm really happy that like we're where we are with your success. And, I feel mutually like, we've had conversations about, what you do in our sessions too. And I think just flowing naturally just helps the whole process. So I'm grateful for you too and what you do. And I appreciate you having me on here. And I can't wait to like see you completely graduate from therapy and just feel the effects of the immense work that you've put in, because myofunctional therapy is not easy. It's homework. It's hard. You have to do it daily, and you have beyond exceeded the expectations of what goes into it. And so that's a huge part of it. And so the reason that you're feeling better is because of yourself at the end of the day. So
thank you so much. And I don't want to end this episode without saying, you and I have worked digitally. So if you're living in a place and you're listening and you're like, oh my gosh, I'm not going to have anybody who does this near me. You can do all of this like over a Zoom session. You can do this over a video conferencing call. So this is very, very accessible. This is one of the benefits of technology. There's so many things that aren't great about technology. When we can come together and really get the help that we need and connect with professionals that can really see us and hear us and hold space for us, that is sometimes everything. So just know that that is an option in this work, no matter where you are or where you're listening to us today. So much light and love. Thank you.
Thank you. Take care.
everyone is looking for. People that will actually care and have like some skin in the game with you to figure things out. And it can't be said enough. Like the work that you do to get somebody out of pain is life-changing. It's life-changing. So I can't do what I do fully when I'm in pain. So you've helped me help so many people, like through the podcast and through my own clients. So thank you. I know it sounds corny, but I'm a big believer that we heal this very messy world one person at a time by doing the work ourselves. And you were just such an example of walking that path yourself, and look where it brought you to helping other people walk that path. And thank you for all you do.
Well, thank you. And I'm so grateful for you and bringing me on here, and for, trusting me and working with me. And I'm really happy that like we're where we are with your success. And, I feel mutually like, we've had conversations about, what you do in our sessions too. And I think just flowing naturally just helps the whole process. So I'm grateful for you too and what you do. And I appreciate you having me on here, and I can't wait to like see you completely graduate from therapy and just feel the effects of the immense work that you've put in, because myofunctional therapy is not easy. It's homework. It's hard. You have to do it daily, and you have beyond exceeded the expectations of what goes into it. And so that's a huge part of it. And so the reason that you're feeling better is because of yourself at the end of the day. So
thank you so much. And I don't want to end this episode without saying, you and I have worked digitally. So if you're living in a place and you're listening and you're like, oh my gosh, I'm not going to have anybody who does this near me, you can do all of this like over a Zoom session. You can do this over a video conferencing call. So this is very, very accessible. This is one of the benefits of technology. There's so many things that aren't great about technology. When we can come together and really get the help that we need and connect with professionals that can really see us and hear us and hold space for us, that is sometimes everything. So just know that that is an option in this work, no matter where you are or where you're listening to us today. So much light and love. Thank you.
Thank you. Take care.
I'd like to thank Hayley for being on the show today. I hope the conversation that we had helped give you something that can help you on the journey. You can learn more about her at restorativemyofunctionaltherapy.com. Remember that my course, 30 Days to Peace, begins on the 1st of the month. It helps you transform stress into serenity with a unique 30-day program offering simple daily practices for cultivating lasting inner peace in just 7 to 15 minutes a day. Visit emotionalbadass.com/peace to register now. Light and love, y'all. I am an emotional badass. You are an emotional badass. Hayley is an emotional badass. And together we are all where Moxie meets mindful. Light and love. I'll see you right here next time for a brand new episode. And I'll see you Patreon supporters for your exclusive episode soon. Light and love, y'all. Till next time, take care. Bye-bye.